Hi, my name is Barbara, and I'm here to tell you my story about vertigo, something I never expected to get, and something which pretty much shut down my life. I woke up one night, in the middle of the night, all I did was turn over. You'd think that would be kind of simple, but I heard this sinewy crunch as I turned over, and then the whole world started spinning. I grabbed onto the mattress. I had no idea what was going on with me. I tried to get up, but I hit my head on the wall, and that's when I realized I didn't even know where up was, that I was spinning so badly. It subsided about 90 seconds, and I thought maybe it was done, so I moved, and it started all over again. The doctor we called during the middle of the night said, "I've never heard of such a thing." And that's really reassuring. So, scared as I was, we went to the emergency room, and they gave me anti-vert, which is supposed to stop the spinning. And it did, but it also knocked me out. So I was told that I would gradually get used to it, and that would stop it. So I never did get used to it. And after 6 weeks of trying to do that, I stopped taking the medication. I was diagnosed with benign positional vertigo and told that lots of people learn to live with it. I was not able to drive. I was pretty much not able to walk a straight line. I was holding onto the walls. I couldn't maneuver well at all. No fast movements, no looking back and forth, no looking up and down, just stiff. People would ask me if I had a problem, if my neck hurt, and I said, no, I just can't move. So after trying the drug that didn't work, I went to an ear, nose, and throat specialist who tried to send me to a vestibular therapist. The vestibular therapist said they have an 85% success rate with this particular maneuver that they do. It's called canalith repositioning. And the theory there is that there are bone chips in your inner ear. When the bone chips can be repositioned, the dizziness goes away. Sounded good. Thought I'd give it a try. Well, that treatment involves getting you as dizzy as you can be, and then sitting you up so that the bone chips theoretically move to a place that won't involve the inner ear. After the treatment, you have to sit upright for 24, 36 hours, 2-3 days, and that actually wasn't a problem because I was already not laying down. Every time I get up or lay down, the dizziness would start. So I did that. It did not help. I wound up having that treatment 9 times and over a period of a few months, and it didn't change anything. So there was other vestibular therapy that helped me actually get used to it, but it didn't get rid of it. So I went through the yellow pages and I found a chiropractor. And having my neck adjusted helped a little, but it didn't make this go away. She said to give her a year and to go 2 to 3 times a week, and that she could help me. So I went 2 to 3 times a week for a year, and as I say, it helped some, but it didn't get rid of it. Plus, the technique itself, having my neck pulled or twisted and the crack, I would go home and have to put ice on my neck, and I would have to kind of rest for a couple days, and by the time I had done so, it was time to go back and get another one. So my body wasn't liking this treatment. So the fact that the body didn't like it, and it helped a little but not a lot, I stopped going after a year. I then found another type of chiropractic, and that person told me they couldn't help me, who referred me to another type of chiropractic. And there are many types of chiropractic techniques. So this third one referred me to a fourth one, who told me that they also could not help me, but referred me then to the upper cervical, the NUCCA doctor. And when I got there, this is over a period of 4.5 years. I've shortened this to let you know that there was a lot of trial and error in between when it started and this actual finding. When I got to the upper cervical, the NUCCA doctor, I was very matter-of-fact about this. By this time, I was very used to what was going on. I lived with this every day. And when he told me he thought he could help me and that he was excited about his being able to get me something that worked, I told him I couldn't get excited. I told him that it had been too long, that I'd been going through this too much, and that I would only get excited when I saw results. So he took the pictures, took x-rays, and showed me how my head was not sitting properly on top of my spine. He said he would do the correction, and that we would see how my body would heal itself. So that's what happened. He took the pictures, he showed me how it was off. He did the correction, and I have to tell you, I thought he hadn't done anything. It was so gentle compared to the other type of chiropractic that I had been to. I just couldn't believe that this was going to help. But the day, I will never forget the day that I started feeling better. I felt good for 2 hours, and it was so weird. I called and left him a voicemail that told him that I had said I wouldn't get excited until I saw results, and I had felt good for 2 hours, and I was close to ecstatic. So it just got better and better from there on. I kept the adjustment. That was 10 years ago. And I now know when something is going to go wrong. I get it fixed way in advance of when I would ever get dizzy again. So all I have to say to you is, if you have a problem and you can't figure out what's wrong, and people have told you that you have to live with it, or you've been told that drugs are the only way to handle it, I want you to know that there are other answers out there, and I hope you find yours.